Today, I'm going to share with you the most important and actionable aspects of veterinary dentistry by describing the secrets to dental success in your veterinary practice. There are standards of care now that have been established over the last several years that basically describe the new age veterinary dental practice as performing full mouth radiographs on all patients and having the capacity to do mucoperiosteal flaps mainly for surgical extractions, and then closure of those flaps to provide elimination of any defects in the alveoli or the sockets and send the patient home with a disease-free mouth based on the radiographic diagnostics and the therapeutic approach based on that. So we're going to take you through the process and in so doing describe 5 places where we kind of run into problems when we're doing that in our practice. And I'm not immune to that. I got out of veterinary school, did not go into and start a residency immediately. I did as you have done in all likelihood, and that's pretty much start with no veterinary dental education or no technical education if you're a technician in that field, and had to learn from hands-on and from courses that were available at the time, which were minimal. So we've all been through the same struggles and obstacles. We're going to outline those, and then we're going to take you through those one by one in detail to provide a pathway or a system to enable you to get your dentistry practice to where it should be from where it is now, or if it is at a high level, maximize that level to the point where it's the best it can be. For those of you who don't know me, I am Brett Beckman. I'm board certified in veterinary dentistry and also in pain management. I have a practice in Atlanta and a practice in Orlando where I see patients about 10 days a month, and then the rest of my time is spent in this aspect, in the teaching aspect, helping practices and helping practitioners and technicians to incorporate what we're about to talk about today into the dentistry service in the practice. So let's get started. This patient was referred by the owner request with the practicing veterinarian because a prophylaxis cleaning, if you will, had been done 3 months prior to presentation. This patient's 7 years of age and had had regular cleanings along with anesthesia-free cleanings periodically throughout its life. And so the perception was that the owner was doing everything that they could for maintaining oral health in this dog. And the veterinarian, obviously, as you'll see in a minute, thought the same thing. And when you look at this patient, there's not a lot of change there grossly that you can immediately look at and demonstrate visually. But if you look at the radiographs, you can see there's profound disease present associated with a lot of the teeth that are here in this right maxilla. You have a huge lucency surrounding this maxillary first molar on the right side. You've got decrease in bone density here in the furcation. You've got a large bone defect, about 80% of the bone's gone adjacent to this premolar. So all of that was not absent 3 months ago when this patient was had its cleaning in the regular hospital. This has progressed from the time of years ago, secondary to periodontal disease.